Namaste. Today topic is ABG. What is ABG in the sense? Arterial blood gas analysis. So today we'll discuss about what is ABG, what are all the indications for ABG and how to interpret the ABG. ABG test is a blood test that requires a sample from an artery. So usually this ABG will be performed from the artery to measure the level of oxygen and carbon dioxide in the blood. The test also checks the balance of acid and base known as pH balance in the blood. So for this purpose we used to conduct a ABG for the patient. So ABG sample will be collected from the artery and to know the oxygen and carbon dioxide level in the blood, and also we can identify the pH balance in the blood. Preferably this test will be conducted by doctors or the senior ICU nurses will be conducted, because they will be more exposed in how to collect the ABG sample from the patient. So the people, those who are aware of the technique, then only they supposed to collect the blood. What are all the indications for ABG? So when patient had a respiratory failure, or when patient is on in a ventilator, or patient had a cardiac or renal failure, when patient is in a sepsis or burn, or if a patient is having a poisoning, so doctor will advise to do the ABG. So these are all the indications for ABG. In a ABG, what are all the important parameters? So we can see pH, PCO2, PO2 and HCO3. So these are all the important parameters we can look into in a ABG. So what is pH? pH measures hydrogen ion concentration in a blood. It shows blood acidity and alkalinity. And PCO2, it is a partial pressure of CO2 that is carried by the blood for excretion by the lungs, known as respiratory parameter. So this PCO2 is a respiratory parameter, and PO2, it is a partial pressure of O2 that is dissolved in the blood. It reflects the body ability to pick up oxygen from the lungs. Next is HCO3. It is a metabolic parameter. It reflects the kidney's ability to retain and excrete bicarbonate. So it is a HCO3 is a metabolic parameter. So these are all the important parameter we can observe in a ABG: pH, PCO2, PO2 and HCO3 level. And what are all the normal range of ABG figures? So we can see pH is 7.35 to 7.45, PO2 80 to 100, PCO2 35 to 45 and HCO3 22 to 28. So this is a normal range of ABG figures. So based on this we have to interpret the ABG. Whenever you see the ABG strip, the staff should analyze whether it is a respiratory acidosis or alkalosis, or whether it is a metabolic acidosis or alkalosis. So immediate action has to be taken for acidosis. So whether it is a respiratory or metabolic. So how it looks, whether it is a respiratory acidosis, in the sense the pH will be low and PCO2 will be increased. HCO3 will be in a normal, and in a respiratory alkalosis pH will be increased, PCO2 will be decreased and HCO3 will be in a normal. And in a metabolic acidosis pH will be decreased, PCO2 will be normal and HCO3 will be decreased. And in a metabolic alkalosis pH will be increased, PCO2 will be normal and HCO3 will be increased. So this is the interpretation of a ABG. So always in a acidosis pH will be decreased, and always in a alkalosis pH will be increased. Mainly in acidosis we have to look into PCO2, and in a metabolic we should look into SCO3 level. If it is a respiratory PCO2 is increased, then it comes under acidosis. In a metabolic, if a HCO3 decreased, it comes under metabolic acidosis.